Congratulations to you, Dr. Snyder, on being the New York City winner of the Doctor's Choice Awards in Psychiatry 2016. How excited are you?
I'm very excited, and I'm honored, and I'm humbled.
You have received great reviews from your peers in the industry. And what drove you to partake in DCA?
Well, the Doctor's Choice Award seemed like a great opportunity for me to support my colleagues, and it gave me the opportunity to actually speak to how wonderful they were, and it was an added bonus that they turned around and did the same for me. I relished in the opportunity to speak highly of those colleagues who I work with, and I love the opportunity to speak to how wonderful they are. So it was just kind of a win-win, actually, at the end of the day.
What inspired you to leap into psychiatry?
Well, so here's a quick story. It's one about how I went into reproductive psychiatry. I was a resident already in psychiatry. It was my first year, and we do a 4 to 6 months on medicine and pediatrics. I was on my pediatrics rotation, and I met an infant, a little boy who was admitted for epilepsy. He had been seizing since he was born. Healthy pregnancy, mom and dad were young and beautiful couple, and they came in just for monitoring of the baby. I had a little boy myself, and I really identified with the mom. I felt terrible for her, and there was nothing anyone could do for the baby. And yet I noticed that no one was really asking mom how she was doing. Obviously she was suffering, and I wanted nothing more than to help. I ended up connecting her with a grief counselor who apparently, per the neurologist who I saw months later, really helped her in her grief. And they instituted a new program after that where every woman whose baby was dying was connected with a grief counselor. And it really resonated with me that I was able to help this woman in a time of need. After that, I actually found out that women's mental health was a field. I loved that I could use medicine, actually, as it turned out, more medicine as well as mental health in one practice. And then following that, I learned more and more. I went to Cornell and did more subspecialized training, and I loved the patient population. I found more functional medicine training. I found that fascinating, and it, built from there.
Can you briefly explain what does psychiatry involve?
Well, I'm a reproductive and perinatal psychiatrist, meaning that I work with women suffering with emotional symptoms throughout their reproductive years. I work with women who have severe PMS called PMDD. I also work with women who are struggling to conceive, some of whom are already in fertility treatment and they're having a very difficult time emotionally, some of whom are not yet in fertility treatment, but they similarly are having a very difficult time. Some women come to see me who have a history of various illnesses, be it depression, anxiety, bipolar disorder, and are either on medication now or have been in the past, and they come in advance of pregnancy, wondering what the safest options are, and we discuss and make a plan and then go forwards. Some women come to see me already pregnant in the state of not feeling well emotionally, and we decide how to then proceed to optimize their health emotionally and physically in the pregnancy, both considering their wellness as well as that of their future baby. And then I see women postpartum who are suffering from any one of the perinatal mood and anxiety disorders. And we consider, breastfeeding as well as their emotional health in the treatment paradigm.
Do you believe collaboration and networking among doctors through services and programs such as Doctor's Choice Awards plays a significant role in the success of a modern medical professional?
Absolutely. I could not do what I do without collaborating with other practitioners. I believe strongly in a collaborative model of medicine, and I think that programs like Doctor's Choice Awards really enables us to work together in a more positive environment, and it connects us with other like-minded professionals. I relish the opportunity to see online, what my peers think of one another in a positive way. And I think it's great to be able to look and say, oh, I know so-and-so and he really thinks that so-and-so is great. So, let me connect. But yes, I think in today's world, we should and can work together for the good of our patients.
What are the key challenges in the field of psychiatry?
So the key challenges include stigma against all mental illness, but especially that in pregnancy and postpartum. Our society likes to think of pregnancy as a time when women walk around with butterflies floating around their head, and in reality that is not true. Women are not immune to any mood disorder during pregnancy, as pregnancy is not protective per se. And we also, as a society and in the medical field, remain scared of medicating in pregnancy. And that is an antiquated view, in that women deserve to be treated if they are suffering. And we as practitioners need to treat responsibly, of course, but we need to, treat appropriately and realize that the risk of untreated mental illness is significant. And so there are barriers to treatment in terms of understanding the risks, and also barriers in terms of stigma.
In addition to being a psychiatrist, you are a teacher, speaker, and director. How do you balance these roles?
I don't sleep much. No, I'm kidding. First and foremost, my kids are always my priority, and that my schedule is always made considering them first. And then I just, my day is broken into chunks and I figure it out. I'm a really good multitasker, and I always find time to do things I enjoy. And frankly, I love what I do. So I find joy in everything I do. I love teaching. I love seeing patients. I love speaking. So for me, going to work is fun. And so I don't know how I do it all. I enjoy it.
What goals have you set for the future?
My goals include just expanding my practice as much as is allowed for by time, and increasing understanding of perinatal mood and anxiety disorders, both for the medical population in terms of other doctors, and decreasing stigma for the greater population in terms of for people, so that women can feel comfortable seeking care if they need it. As I said earlier, there's still a great bias against treatment for women in pregnancy, and the more we know that is unfair and unnecessary. And women who seek treatment get well, and that's good for themselves, that's good for their future baby, and that's good for their entire family. So my goal as a practitioner is to improve understanding on a larger scale for the good of women and their families.